Independence for Change, Deputy Tommy Broughan, you have 5 minutes.
14 months ago, Minister, in the run into Budget 2019, I advocated additional new net policy spending, including new revenues, especially for the Departments of Health, Education and Skills, Housing, Justice and Children. But your Fine Gael, Fianna Fáil austerity governments, of course, since 2008, you've resolutely refused to fund essential services of our people across all those and other sectors of government. And once again, of course, we need these major supplementary estimates, in this case of 634 million, just to fund crucial day-to-day operations of hard-pressed departments and the HSE. Mr Paul Reid, of course, the CEO of the HSE Cathaoirleach, he told the Oireachtas Health Committee in early October that he thought the HSE could break even this year. That was because he said he'd instructed HSE managers to limit overspends by curbing staff levels, overtime and the spend on agency staff. Now, we deputies, of course, know there was an actual embargo for the last 9–10 months operated by Mr Reid and by Minister Harris in recruiting additional staff for desperately needed therapies and hospital operations. But despite these measures, we now see in the supplementary estimates that Vote 38 needs an additional 338 million for 2019. And the bulk of the funding, of course, seems to be needed by the health and social care services and for primary care reimbursement purposes. At the Health Committee yesterday, Mr Reid said the overrun at the end of September was almost half that, of course, in 2018, and that the HSE workforce now stands at 138,000 personnel, representing 119,500 whole-time equivalents. But the question we have to ask, Minister, is why did Mr Reid and the HSE board only very recently submit a service plan for 2020? How can we allocate in this House budgets if the HSE and its Chief Executive don't actually give us a service plan for the next calendar year? It seems incredible, an incredible anomaly. Because the key problem, of course, in health supplementary budgets and overruns is we know the horrendous waiting lists for acute hospital treatment, and Deputy Martin yesterday referenced the 200,000 children on current waiting lists. So the 2019, 2018 and all the earlier austerity budgets clearly did not realistically allocate the necessary funding for health, social care and disability services. Now, does the 2020 plan that I think you now have, Minister Harris now has and the Cabinet now has for the HSE, does it remotely meet the delivery costs of these services? Or will this Dáil or the next Dáil, probably the next Dáil, have to revisit Vote 38 again for supplementaries in the autumn of 2020 or perhaps much earlier due to Brexit? Of course, the Budgetary Oversight Committee, as you know, Cathaoirleach, we've been raising anomalies in Vote 38 for the past 3 years. In fact, originally Dr Sean Healy of Social Justice Ireland, he drew attention very clearly at a presentation to what we all know, the predictable shortfalls in health expenditure. I think 2 or 3 years ago, Minister, it was over 800 million, almost $1 billion less than was needed to operate the service. And of course, the Irish Fiscal Advisory Council and the Parliamentary Budget Office, they've both drawn attention to the same situation. Now, the Fiscal Council, of course, defines a prudent fiscal policy, Minister, as one, and I quote, where net policy spending growth does not exceed sustainable growth in revenues. But that doesn't preclude ensuring we have sufficient revenue in this House, in our budgets, to run a modern, universal and quickly accessible health service. Budget 2020, of course, as colleagues have said, was a regressive standstill budget for citizens and social protection, benefits, assistance and pensions. We might as well not have had a budget at all, Cathaoirleach, as that budget a few months ago, and for lower paid workers generally. And the payment of course, the Christmas bonus, which I think is a net 100 million, Minister, isn't it, in the books, it can't erase the cynical failure by this Varadkar government and their imposition of a possible disorderly Brexit cost totally on the most vulnerable citizens in this community. And in terms, of course, of transparent management of the public finances, Minister, Christmas bonuses for the following year, we should decide on it and clearly and put it into the main budget and stop this messing and pretending year after year. In education, the 68 million additional there that we have in the books, the PBO, of course, has drawn attention to the demographic bulge, which is moving now on from primary to post-primary level, possibly peaking in 2025 and then moving on to third level. And at the Budget Oversight Committee, of course, I advocated that the additional teachers that may be released by the movement that that bulge. They should be used to dramatically bring down the pupil-teacher ratio. Of course, it has to be welcome that the Parliamentary Budget Committee has been meeting, engaging with the larger government departments, and that the focus of the committee, I think, early next year, up to the general election, will be forecasting and management of demographic factors. Because that's the key point, Minister. I think the committee is rightly concerned about the use of outdated demographic projections in Budget 2020 and the need for budgetary allocations to accurately reflect demographic pressures. So I hope we have that and the additional spending that is essential and necessary, perhaps this might be one of the last years where we'll have this kind of charade and we can consign the annual supplementary budgets to history, and we'll have realistic annual budget year in, year out. Thanks, Cathaoirleach.